It now gives me enormous pleasure to invite Dr. Owen Kelleher to the stage to address the class as Class Valedictorian.
Good afternoon. It's a long walk. President of the Royal College of Surgeons, Pro-President of the Royal College of Physicians, Chancellor of the NUI, Dean, faculty, fellow graduates, guests and friends from all over the world, bank managers eagerly awaiting loan repayments. Ladies and gentlemen, Mum and Dad, it's a tremendous privilege to stand here on behalf of the class of 2014 to have the opportunity to share just a few words of our time here in the college. Today is a bittersweet day. Bitter because we're leaving the college and we're leaving our friends to move on to the next stage in our lives. But sweet because we're leaving the college and we're leaving our friends to move on to the next stage in our lives. RCSI is unique. What distinguishes us is our diversity. Diversity is a word we hear all the time here in RCSI. But I graduated from a high school where 90% of my class came from the same neighbourhood as me. At that time, I thought diversity was when people from Dublin's north side and south side mixed. But I was wrong. We have 30 different nationalities in our class. Now, not only do I have friends from the north side, I also have friends from places as diverse as Canada and Norway, Kuwait and Malaysia. We've enjoyed celebrating Thanksgiving with the Canadians, having the Norwegians teach us their national anthem on nights out, eating delicious home-cooked Malaysian meals and climbing trips in Belfast, and having the Trinidadians teach us how to dance or whine. Medicine is a very international profession. In Ireland, we have one of the highest proportion of international doctors in the world, and we Irish medical graduates ourselves travel all over the world to practice and to train. The cultural diversity here in RCSI, I hope, has broadened our horizons, and I think we will all come away from this college with a great tolerance, respect, and curiosity for other cultures. But if what distinguishes us is diversity, what binds us together is medicine, which is almost a country of its own. It has its own language, a mixture of Latin, Greek, and acronyms, from gubernaculum to ABG. Its own customs like the white coat and stethoscope, rituals like the clinical exam, and extremely strict border controls. Being introduced to this new world is certainly a trial by fire. Hot off high school exams, which were more of a marathon, first med's a lot more like the hurdles, with opportunities to trip up at every turn. There are card signings and MCQ tests, pharmacology, where we learn of common drugs like paracetamol, moxifluzine, benzoneomycin, biochemistry, where we learn about the Krebs cycle, and not to mention summer exams and January exams, as if your Christmas wasn't important enough. It's hard to stay on your feet with all that, let alone stay in the race. But we all managed. And the early years in RCSI were much more than anatomy classes and lectures. We enjoyed pool tournaments in the basement of Stephen's Green. We got acquainted with the Swan, and were one of the last years to remember ballad session in the O'Flanagan Lecture Theatre. With second med came the big move to the hospital. After learning how the body works for a year and a half in junior cycle, it was time to learn how the body does not work in intermediate cycle. Not just with pathology and microbiology classes. We also got a personal taste each time we had to drag ourselves out of bed for an 8 a.m. lecture. At home, my desk was littered with post-it notes containing mnemonics for just about everything. I was told I had a problem. In fact, I knew I had a problem when I even had a mnemonic for the members of my own family. Intermediate cycle was indeed like sitting down at a feast, like at Thanksgiving, Christmas, or Eid. You're immediately overwhelmed by all the choices. From adenomas to Zonninger-Ellison syndrome, everything's on the table. You try to sample everything, and you try to stuff it all in, and you end up so full you think you couldn't possibly take another bite. But then you realize it's all good. It was all about regurgitation anyway. Eventually, we moved from the safe confines of the lecture theatre to the hospital wards. I'll never forget my first encounter with the surgeons. I spent what seemed like 10 minutes scrubbing my hands so I could scrub in. I managed to get myself into a paper gown, and after the fourth attempt, got the gloves on. I stepped up to the operating table. I squeezed between the registrar and the SHO to peer down what was happening. I'd never seen real-life surgery before. I remember I asked the consultant, who will remain nameless, "Sir, is that the spleen?" And he looked up, clearly bowled over by my enthusiasm and eagerness to learn, and he said, "Who are you?" But then senior cycle came, and with it we met the Jeffs. Like a fine wine, they'd been matured over the years before they reached us. And like a fine wine, they were occasionally sour, at their best drunk, and completely overrated. Fourth Med was a busy year. On obstetrics, we delivered babies. On GP, we saw the variety of ailments that people present with. On pediatrics, acute children won many of us over to career looking after sick kids, but the toddlers throwing tantrums turned the rest of us away. On psychiatry, we saw anxiety, depression, and obsessive-compulsive behaviours, and that was just our classmates. And then came Final Med. It was a year full of memories. There was the serious stuff, case presentations, TOSBAs and TOSCIs, short cases and long cases. There was the stress. At one point, my girlfriend asked me how I was, and I replied, "Owen Keller is a 23-year-old student from Dublin who's complaining of recent onset palpitations and insomnia and a background history of extensive caffeine dependence." Indeed, we did acquire quite a taste for coffee. Over the year, we went from mochas to lattes to plain black coffee. Much like the Krebs cycle, our coffee became steadily darker and progressively less sweet as we moved towards the end. But there was also a lot of fun. Our last ballot session in the academy, our last sports ball, nights in the Swan, road trips down to Waterford and Drogheda, and our last college ball in this very building. We went through a lot together to get to today, and I hope I'm not being cliched when I say that this class has been a very special one, and a very tight-knit one. We celebrated together in a boat in the Liffey just outside the door when we finished our final exams. 100 of us went to Turkey last week, and by some miracle, 100 of us returned. And it says a lot about us that after the past few years, we can now travel to almost anywhere in the world and be sure of someone to show us around. And so it seems fitting now to give a few words of thanks, which may be more fitting of an Oscar speech. Firstly, thank you to all our friends and family who have put up with us, who have supported us, and who have been there for us over the years. I must especially thank my own parents, my own family, for all the support and encouragement they've given me. You've been waiting a long time for me to be able to diagnose that persistent headache, treat that niggling cough, and tell you which health insurance plan is the most promising for you. And rest assured that after today, I can still do none of those things. Thank you to those who kindly donated their bodies to the Department of Anatomy so that we may learn. These generous people became our first patients, and we are deeply indebted to them. Thank you to the people of Ireland who receive healthcare in the Irish health system, especially the public system. As patients, these people sacrifice their time and their privacy so that we may learn. We get so used to taking a history or performing an exam that it's easy to forget how unusual it is for a perfect stranger with little direct involvement in your care to pop their head between the curtains and sit down beside you and ask you a string of deeply personal questions that would make a tabloid journalist blush. I want to thank another group of people who have also been indispensable to our education, the doctors and nurses of Ireland. A huge amount of our education comes from hospital staff. For many, it's not their job to teach us, and the vast majority are not paid to do so. And yet, almost each and every one takes time out of their day to teach poor medical students on the ward. From interns and SHOs who talk us through ward rounds to registrars and consultants who take us aside for tutorials, we're deeply indebted to these people. But this isn't unique to RCSI, and it's not unique to Ireland either. It's a feature of the profession of medicine. The very first part of the Hippocratic Oath implores us to share our knowledge freely with those who wish to follow us in the profession. And we are proud to be entering into such a profession. I hope we all uphold these values and continue to teach freely all those who care to be taught. I've also had the privilege of being your class rep for the past year, and I want to thank you, the class, for that. It's been a real honour. But in particular, I must thank my colleagues, Nadia and Hadil, for all the work they put into life here in RCSI. Not just this year, but every year I've been here, they've been integral to class life. As I mentioned at the start, medicine can become consuming. I wasn't joking when I said it's like a country. It can be hard to escape to the outside world sometimes. And there are plenty of examples of doctors who've fallen victim to the stress and pressures of the job. But we must remember how important it is to care for ourselves. Only by retaining a sense of humanity, a sense of empathy, and a sense of humour can we ever hope to care for anyone. And with this in mind, I want to thank a particular group of people who are special to me. Harriet, Michael, Elizabeth, Elaine and Alan, or the study group. Without them, I wouldn't be standing here today. And since the first semester of first year 5 years ago, we've gotten together what were variably dinners and study sessions. We practiced histories and clinical exams. We made notes and quizzed each other, but more importantly, we're there for each other. And what I learned most over the years with them is the value of teamwork and the value of being there for each other. You can't study medicine alone, and you can't practice medicine alone. What I've been trying to emphasize with these thank yous is that we rely on so many people. Our patients, our teachers, our colleagues, our family, and our friends. Harriet, Michael, Elizabeth, Elaine, and Alan are just one of my examples, but we all have many of our own. Atul Gawande is a surgeon and author from Boston who's written many books in medicine, and I'm sure many of you have read them, and if you haven't, you should. In one of his books, he compares the practice of medicine to working at a pit stop in a Formula One race. It's not the romantic ideal of men in white coats rushing in to save lives, but it's quite accurate. Good medicine is people working closely together, anticipating everyone's move, and knowing your place in the overall scheme of things. And that's one of the things I like most about medicine, the sense of purpose, the sense of place. Each day we will make a difference. Our job matters, and we matter. And so to the class of 2014, I would like to thank you for the privilege of being your friend and classmate. I want to wish you the very best the next stage in your lives, and always look after yourselves. I will leave you with the words of Hippocrates, a contemporary of some of the older Jeps in the audience. May we long experience the joy of healing those who seek our help. Thank you.
Thank you. Small presentation.